We're back again with Grazel from GGPA, and today we're talking about neurodiversity. We're talking about how individual therapy works with different personalities, different identities, and different neurotypes. So, Grazel, I know you've written a book on ADHD couples therapy, and as part of that, you you don't just look at the relationship; you look at the individuals in the relationship as well. Um, and I know you in that book you recommend that each member of the couple should be in individual therapy. Do therapists typically understand how ADHD plays out in adults?
Thanks for kind of naming the book here because it's really important to know that individuals, even though they're in a relationship, that each of them have a role in fueling a negative cycle. So it's really important to do individual work in tandem of couples therapy. And to answer your question, do actual therapists see if ADHD is actually present in their work? Um, Yes and no. Yes, if the therapist is neurodiverse informed, and no, if they don't have any training in it and they can't really name, if they don't have training in it, they won't see it. They won't know that there's a neurotype difference that's playing into the way that the individual is presenting in the room.
Yeah, okay. Obviously, within neurodiversity, there are people who struggle with different aspects of life, I guess. So there's people who struggle socially, there's people who struggle internally, and maybe how they present to the external world is very different to how it is internally. Um, how does therapy look different for those two different types of people? Kind of, I guess, people who internalize versus people who have issues externally.
Wouldn't, if we tunnel it to neurotypes. When it comes to someone who identifies as an ADHDer, um, their internal process in experiencing emotions definitely looks different externally. Um, Most of them, if not all, may say that may show that they're very angry, but inside it's just a normal level of anger.
Okay.
But when they express it, it's bigger because that's how the brain processes information, especially emotions, is it's a lot more intensified for them. So when they express it, the partner who doesn't have ADHD can feel that intensity. But to them in the inside, it's not that intense. So
Mhm.
it can be different.
Yeah, and I guess with neuro clients with ADHD or any kind of neurodivergence in an individual, that kind of internalizing is so common because you can end up criticizing yourself quite a lot. Like, why can't I be different? Why can't I just blah blah blah? Because maybe you don't even know you've got ADHD.
Hmm. Hmm.
How do you approach clients like that who are really intellectualizing everything, really overthinking everything, rather than just realizing, no, this is part of who I am and I need to find a way to manage it?
Right. So I think you make a great distinction here. What if the clients that's coming in doesn't even know that they're neurodivergent,
Mm.
right? And they've internalized the neurodivergent traits as how they are as a person. And but they just need help in managing them. I don't necessarily have to put a label on their neurodivergence, if it's not important.
Mhm.
But within the context of understanding who I'm helping, I may need that diagnosis or label inside my head. However, I don't need to tell them that they have to have that label. Uh, but we can still look at the traits that's creating distress in their lives. So if they're not ready for that diagnosis, for that label, it's totally okay. If they just want to bring up that, hey, I show a lot of intensity in moments when I'm feeling dysregulated and it's affecting my life, then we just work on that. We don't have to put a label in it. We just have to attend to the feelings that's coming up.
Mm. And when you're working on that, how effective is that? Because I know there's the medication route for neurodivergence, there's the therapy route, and there's doing both together. Do you find that it's effective without medication?
Um, Depends. It really depends on who's in front of me. Again, the first thing first is creating safety. If the patient is not ready for that diagnosis and they're in denial, it is okay for me to meet that denial.
Mhm.
And I have to meet that denial because I can't get moved forward without meeting that denial, right? And I just have to work with that. And we work together and we're walking hand in hand together until they become more confident about, hey, there's nothing wrong with this label.
Mhm.
And once they get to that point of acceptance, then I can meet that acceptance and then provide resources. If I feel that medication is important for them to be able to implement the skills I'm teaching, then I will recommend it for them to see a psychiatrist.
Mhm.
If I feel that the skills in managing the neurodivergent traits is being implemented okay, and they don't require medication to make it easier for them, then they don't really need medication. But if they want it regardless, then I'll say, okay, here are my respected psychiatrists that you can see that specializes in neurodivergence. So I walk alongside with them wherever they're at.
Yeah, and they're the one that makes the decision at the end of the day, which is really important for them to remember, I think. Um,
Yes.
in terms of therapy within neurodivergence, are there any specific therapeutic approaches that might work better for someone with ADHD versus someone with autism versus someone with other learning difficulties? Or is it just kind of really down to the individual?
I think I think everyone that's looking for a provider needs to look for a provider that has specialty in what they're looking and needing for to help them. I think I've shared this to you or to many of the clients that's looking for therapy. If you're looking for a particular type of treatment, and let's say for autism, and that practice doesn't work with autism, you don't go to them. Don't go to them, right? It's like going to a general practitioner when you're actually looking for a cancer specialist. They're not going to be able to help you,
Yeah.
right? So I think it's important and to find the right therapist that can actually understand you and not judge you and not tell you that you're wrong because they don't know how to treat neurodivergence.
Yeah, and I guess there's enough of people in California who treat neurodivergence that you should be able to find someone to help you. Would you agree with that?
No,
Oh.
yeah, there's not a lot of therapists that specializes in neurodivergence because the mental health field is becoming more aware of how neurodivergence is actually very prevalent and the there's studies more now than ever before, but it's there's not a lot of therapists that are actually able to seek those types of treatment yet because there's not a lot. So we have to actually seek it out and find the right treatment for these trainings for these populations. Um, but not a lot in California. So, but there are a number. I wouldn't say a lot. There's several. So finding a therapist that specializes in neurodivergence usually know other therapists that do. So it's good to go to that person and get a referral.
Yeah. Yeah, that's good to know. But yeah, thanks again for your time. We'll speak again soon.
Okay, thanks.